So what we really reviewed and discussed was the question of non-Alzheimer's dementias. We talked about the course of these diseases, how to diagnose them, how to treat them, and went over a few clinical pearls that we think it's important for our community to know about in order to help us best treat our patients and their families.
And the formation of our talk was around cases so that we could give people some practical examples of how these different forms of dementia would present. And so working through the cases, we talked about typical issues that would come up in terms of making a diagnosis, figuring out the prognosis, and then actually making advanced care planning decisions.
From my perspective at least, the two most important takeaways are really the importance for us as palliative care providers and hospice providers to truly know the diagnoses, to use our amazing clinical acumen to be able to diagnose these patients and look at them through a different lens than any other provider has looked at before. Knowing the diagnoses, I think, really helps us advocate for our patients and families and help best prepare them. And I think from a prognostic standpoint, it helps us truly achieve our goal, which is the best quality of life for our patients, by using the medications at our disposal the right way, rather than what everybody else thinks we need to do.
And I think another aspect of it was, in terms of making the diagnosis, was also being able to focus on education with families and to see that as a powerful instrument for treating patients, as well as having, education for the primary care doctors and setting up expectations.
I think know that what we do is important. The world of dementia is vast, and the number of patients that we're going to continue to treat with both Alzheimer's dementia and non-Alzheimer's dementia is going to truly grow over time. I think our role and our gift as diagnosticians in this field is going to be very important to round out the care for these patients, and that's something we need to be aware of and really help use it to advocate for our patients and families and prepare them.
And I would say also keeping it simple is one of the biggest aspects. So as complicated as these different illnesses are, we want to keep it simple. We want to keep it patient-focused, caregiver-focused, and we want to use the tools there. So I'm a geriatric psychiatrist, so using your colleagues, using your social work colleagues, nursing colleagues, psychiatry colleagues to help you manage these patients and keep them in the community.
And really the team. We have a palliative care team, we have a hospice team. The team expanded to the neurologist, the psychiatrist, to really optimize the care of these patients, not treating them as any other patient with dementia, but really their own unique individual, which is so much more important with these non-Alzheimer's dementias. It helps to create a care plan that's very patient-focused, and sometimes we are the first people who have that discussion. It's so relieving for a patient and family to know that everything that they're saying or everything that they're seeing has a reason behind it, and that there's actually people who can help them cope with it better, deal with it better, and are going to be working with them. So I think that entire team with the patient, the family, us as the providers and the subspecialties working together is really something that is best highlighted when caring for these patients.